Hello, everyone. Thank you for joining us today for another event of the Radiology series. I am very pleased to have Dr. Hamza with us today again, and he will talk about AI in radiology. So, Dr. Hamza, the stage is all yours.
Thank you very much. Really appreciate that. And thank you very much to everyone who's here at the moment. This is the last of the series. I wanted to thank you guys for attending our lectures, and I hope that they've been helpful or at least insightful in some way. We've had a lot of fun doing this, particularly with UIMS and also Pleven University, Humanity Society, both of you guys. But I think UIMS have been the key hosts of the whole thing, and this has been going on since October. So genuinely, really appreciate everything that you guys have done for us. It takes a lot of time, and your organization skills are absolutely impeccable. So yeah, spoke a little bit about those, and also I wanted to extend my thanks to my colleagues, Dr. Karthik and Dr. Tiju, who have done this with me, and our supervising consultant, Dr. Paramis. Once again, so yeah, we're going to be talking a little bit about artificial intelligence. This is quite a short presentation. It's not a long 1 hour presentation. It's probably going to be about 20 to 30 minutes, and not more than that. Well, that's because, to be honest, we're still working on this, and I think I mean, as a whole medical universe, are working on implementing AI in virtually every medical aspect and field. So we're going to be talking a little bit about the use of AI in radiology, a little bit about the history, and some other things. And as I said before, we are junior doctors, not clinical radiologists. So if we make a mistake, I do apologize. So, yep, we're going to be talking a little bit about history, when AI has been used before, in what circumstances, and how it's developed over the years. And it's quite a fascinating history. But to be honest, there's a key few milestones that we can all pay attention to. The second aspect is we're going to be looking at some of the current uses of AI in radiology today. So what are the things that it's being used for, and how it's helpful, essentially, and some of the advantages of having AI in radiology. And then to those who are here, I'll leave it up to the floor to decide whether you think it's going to be a good thing for radiology or not if we have AI. Lots of people say different things about this particular question, and I think it's the main hot task or hot question that people are talking about nowadays. It's the talk of the town, as they call it. Will AI replace radiologists? And radiologists seem to say no. Other people seem to say yes. So don't go into radiology. I don't think it's deterred me or my two other colleagues from going into it. And I'll explain my reasons in due course. So, what is AI? AI is essentially, in a nutshell, it's a very complex type of technology which essentially involves problem-solving capabilities. So what does that mean? That essentially means, by the way, please let me know if you have any issues hearing me. For some reason, my camera's not working today. It was working about 10 minutes ago, but if there's any issues hearing me, then please let me know. And any questions, you can put in the group chat. So yeah, provide by problem-solving capabilities, essentially, human beings have a tendency of liking easier work. We like it when we have something that will help us do our job. And AI is a very smart umbrella. Well, it's an umbrella for smart tools that can be used to speed the way work is done. In a nutshell, and it can be used to make accurate results. It can be used to relay those results to patients. It can be used in a number of different aspects of radiology, and there's different types. It will the two major types are weak and narrow artificial intelligence. So weak or narrow artificial intelligence is basically the first type of artificial intelligence that was introduced. and it's quite specific to the task. Most of the time, it involves a human operator as well, but it's not as complex essentially. So that's weak, and then you have strong or super artificial superintelligence, and that can essentially mimic multiple human capabilities. So it's able to extract data, use that data, um, uh, formulate results, and be used in things like research as well. So the two major types are strong and weak. Um, how does artificial intelligence actually work? So these two types, what is the mechanism or the machinery that is used for it to work? So essentially, a little bit like you have in the human body, you have something called neural works, and neural works are essentially different types of, you can think of as learning systems. Okay, they have different levels, and all these different levels communicate with each other. Okay, and essentially, what happens is you've got two different types of learning systems. You've got the machine learning and deep learning. And the key difference is that in machine learning, you essentially have, as I kind of mentioned before, real human beings that are structuring how it works, and it's basically called supervised learning. Okay, so it's able to extract data, it's able to use that data, it's able to formulate results, but it needs a human being to supervise it, essentially, um, which is different to the deep learning. And the deep learning essentially does not need human supervision. It's a lot more complex and a lot more powerful as well. And resultantly, it's used in larger sets of data, so data that's quite complex to understand, and we're talking about things like major research projects that are happening in cancer centers and things like that. So you've got two different types of artificial intelligence, and the way that they work is by the neural works or the learning systems. So a little bit about the history. I'm not going to bore you too much with this, but people think that artificial intelligence has been or is coming into medicine now. And to be honest, that's not entirely true. Artificial intelligence has been used in medicine since the 1960s. Of course, at the time, it was used in very limited capacities. So, studies such as systematic reviews show that the initial usage were in fields such as pathology or dermatology or even mammography in the beginning. And the key usages were in relaying results to patients, in interpreting results, and also storing that data as well for future research projects. It's only in the last decade or so it's more commonly used in other medical fields such as internal medicine, so things like cardiology, cardiac MRI imaging. But as I said, yeah, that's in the last decade, and even more so accurately since the 2000s, really. So each decade since the 1960s had its own kind of milestone. In 1970, for example, AI was used more in research-based work, and in the 1980s, that's when we started to learn a little bit more about machine learning. So it's a gradual development since the 1960s, and it's not something that's new, essentially. It has been used in other aspects of medicine before, and now in radiology specifically, they're trying to introduce it to a number of different fields. So, some of the current uses of AI in radiology, you'll find this in bigger hospitals in London, for example, or some hospitals in the US. So, in terms of general radiography, there are some specific sequences that are used to check image quality. And image quality is actually a problem which quite a few radiographers struggle with sometimes. The quality of the image is dependent on the technique that's used to take the image. It's also dependent on the kind of machinery that's used as well. And now we have certain tools when we're looking at things like X-rays or CTs where we can be a little bit more precise and read between the lines, but with a little bit more precision. But to be honest, that takes a lot of effort sometimes, and our work would be much more useful if we had these sequences to check image quality. So if the image quality isn't correct, then we can use AI sequences to help improve that image quality, or even help take serial X-rays of the same patient. Um, Moving on, as I said, that AI is now being used in things like cardiac MRI imaging for patients who have had myocardial infarctions or atrial fibrillation, a number of cardiac issues, essentially. And this is more from a diagnostic perspective. It's used to diagnose certain conditions, um, uh, and also used to relay those results to physicians. It's not being used as such to relay the results to patients as yet, but there are some places in America, such as California, for example, where they are using AI to relay those results directly to patients, and it's mainly in the form of an app. So the tool comes in the form of an app. Um, and thirdly, of course, relaying diagnoses such as cancers. So when something is at the moment, for example, when you do a CT scan or an MRI scan, and there's abnormal mass that's been noticed, then usually there's a specific coding for things like cancers or tumors, and the patient is followed up in a particular clinic. Now there's AI that's being used to essentially first give a more precise diagnosis as to what it could likely be, rather than give a differential diagnosis of 5 or 6 different conditions. And it can also be used to relay that information to patients as well, saying you're going to be followed up in the following way, and this is what your follow up will basically include. So these are all things which essentially can cut down the time spent on these aspects by physicians, so that they can focus on the actual medical aspects, if that makes sense, of the treatment, of the management of the condition, or, for example, if needs be, interpretation of the images in radiology, or overseeing that anyway. So some of the challenges to artificial intelligence in radiology are using it. So the first is basically, I think most countries will have a college or a council of some sort that oversee all radiologists. And in the UK, for example, we have the Royal College of Radiologists. And with the Royal College of Radiologists, there's now a registry. So all AI tools that are being used are being registered with the Royal College of Radiologists. So they're aware, so is everybody else that is a part of the Royal College, is aware of the kind of tools that you can use for image interpretation, or even more specific diagnoses. Um, another interesting aspect is linking or marrying up essentially medical guidelines with specific artificial intelligence outputs. And what that really means is we have our clinical guidelines, but how do they match up with outputs? How do we match up the output from, or the level of usage of our artificial intelligence currently? So in, for example, clinical guidelines such as the NICE guidelines, there are specific treatment management plans. Um, this specific aspect looks at, for example, if we use artificial intelligence to diagnose a patient, how many of them would follow a specific pathway and how many would not. So that's that aspect, and that's something that's still being looked into at the moment. Third is something which some people debate on, but human reluctancy. So because it's a new type of technology, it means that it has to be learned, essentially. People have to be educated about it. And this isn't specific to radiology, but can be applied to most medical fields. So if a doctor or a nurse feels that actually, you know what, we don't exactly want to be using it because it's quite complex, then I think that what will end up happening is that any data that they are producing, or any data that they're using will take longer to interpret, and also it probably won't be as accurate as well. Most people will eventually jump onto the bandwagon of using AI, and actually one of the sayings that I've heard for radiologists is AI may not necessarily replace radiologists, but radiologists who use AI will replace radiologists that don't use AI. So it's going to be something that most people have to use, and those people who are a little bit more reluctant to not using it may be at a disadvantage. Um, Data quality. So once again, as I said, there are a number of factors that can affect data quality, technique being used, the infrastructure or the type of machinery that's being used. And with AI, all of these factors have a less of an impact or less of an effect, essentially. And you can also take imaging to a larger number of images in the same amount of time using artificial intelligence, as I said, things like general radiography, for example. So these are a couple of things which are being debated on at the moment and can be seen as challenges, essentially, into using artificial intelligence. But nevertheless, I think it's a debate that's going to be going on. So yeah. So I know a lot of people talk about the different advantages of AI. There's a number of different advantages, and we've spoken about a lot of these already. But I think the one of the key things I wanted to highlight here was early detection of particular diseases, or even things like tumors, for example. So in the case of oncology, AI can really speed up things like management plans and treatment for patients who have specific types of tumors. Um, and the second aspect of being improved prioritization, they can essentially prioritize which patients would need quicker treatments or specific types of treatments depending on the stage of their tumor or stage of their cancer, essentially. But there are a number of other advantages, which include improved accuracy. I guess in terms of reduced radiation exposure, in the sense that the images can be taken in larger quantities, the patient doesn't have to be exposed to that radiation constantly. And effectively, all of these things would lead to a faster diagnosis. So there are a number of advantages to using AI. And to those people who are here, I wanted to open the floor based on what we discussed as to what they think of in terms of what are your thoughts? Do you think AI would be a good thing, or is it too good to be true? Okay, no worries. I don't think we have any comments. That's fine. So yeah, I think overall, just to summarize, we've talked a little bit about the usage of AI and the different types of AI being used in medicine and in radiology, some of the advantages. And I think that my thoughts essentially are that AI will not replace physicians or even radiologists. I think AI will affect every field in medicine. If you look at primary care, for example, AI is being used in different triaging systems and that again is used to prioritize patients who may need to be seen sooner than others. Um, it may also be used. I think Herendia said, I think it's definitely a good thing, but I feel like with all of it should be monitored. Yeah, I think most systems at the moment are going back to what we discussed before. Most systems at the moment are in the machine learning phase, so they'll need to be somewhat supervised. I don't think most systems are at the stage where it's deep learning. I think we're in a phase where we're initiating the deep learning phase in most AI systems. So we're not just there yet. And I think you're right that we'll need will need to be supervising things, and especially in the case of radiology, I think that'll be the case as well, because you'll need to have someone to supervise the diagnosis being given or differential diagnosis for each scan. Most scans also require a recommendation for the clinician that's looking after the patient. So providing that recommendation will be a lot of the time it's coded for, if I'm being honest with you, but it needs to be checked over by a specialized radiologist of some sort. I also think that with AI in radiology, it's going to have a bigger impact in diagnostic radiology as opposed to the surgical types or interventional type of radiology. So it will push a lot of fields in radiology to become a lot more interventional, if that makes sense, which I think is quite fascinating. So a lot of surgical procedures at the moment are already being taken over by interventional radiologists, things like vascular radiology, for example, neuroradiology, which we spoke about earlier on, and that takes that talks about things like coiling, aneurysms, strokes, all this kind of stuff, and eventually they'll be able to use AI even in that as well to different extents. So I think it has a very exciting future. And I think that it will definitely make the life of a physician or radiologist or surgeon a lot more easier than it is currently, because they have to spend less time doing things that they won't need to do at the time. But I do agree that it needs to be monitored. There needs to be some checking over it. Otherwise, there may be a tendency for there to be mistakes. After all, yes, it's a type of intelligence, but essentially, a lot of it is man-made. If that makes sense, we are the ones that are developing that intelligence and using it. So, yeah, that's what I think.